setup. We've got a little palm tree here, Arnie chilling in a little sack, and the TV. Hopefully one day we'll have an interview here. Okay. Once again, thank you for choosing this channel. We're going to do it quick. All right, we're going to be reviewing the PowerPoint today of the knee. Here we go. So today's topics, the meniscus and what they are, and do you need surgery, and what their efficacy is. The ligaments of the knee, what the patella is and its function, and common injuries and pathologies. So, do I need surgery, or what is a meniscus? So, we have articular cartilage anywhere where two bones meet at the knee, and they're called the meniscus at the knee. So, anywhere where two bones articulate means like the elbow joint, the wrist, the knee, anywhere where two bones contact each other is where this articular cartilage is going to be found. And the job of this articular cartilage is to reduce friction and absorb shock. As like in the knee, let's say you jump, right, and you hit the ground. If it was bone on bone, it'd be a lot more hard on the bones, okay? And when you walk as well, you flex the knee, you're rubbing and rubbing, and it's like a shock absorber. They're a 1/4 of an inch thick. So I have a GIF that I will be putting on the screen. Meniscus blood flow, outer versus inner. So if you see on the picture here, right, on the outer portion of it, it's very vascular. And what does this mean to you? It means that the blood flow gives nutrients to the body, okay? So as it receives this blood, it's able to regenerate and receive nutrients to build itself back up. So the outside portion of that meniscus is very vascular, but the inside is not vascular at all. This is for more older people, okay? So if you're like 17, 18 or younger, most of the meniscus is very vascular, so you don't have to worry about it. Okay, well, if you're worried about it, go see a doctor. I'm not telling you not to. Okay. Medial meniscus is more prone for injury, and being a woman as well will put you in more risk for that medial meniscus. So what does this mean? So your medial meniscus is on the inside of your leg, okay? Women's hips tend to be larger, and they have a larger Q angle. If you want to research that, we'll go over that later. But basically it means when you stand up, right, and you put weight into a leg, the alignment of the bones just a lot tougher on the medial disc, especially if your hips are wider. Just being a woman. Sorry. Okay. Surgical meniscal repairs and non-surgical meniscal repairs with exercise rarely have different outcomes. We're going to go over that a lot more in depth. That's crazy to me. Surgery outcomes. So I'm going to post a link in the description just so you don't think I'm just saying this stuff. A study was done with 140 patients with meniscal injuries, and 2 years later, both groups of patients had fewer symptoms and improved functioning. There was no difference between the two groups. However, those who had exercised had developed greater muscular strength. Surgery yielded no additional benefits for patients. So, train with a physiotherapist, okay? In the study, the patients attended training sessions with a physiotherapist 2 to 3 times a week, which is no time at all, okay? For 12 weeks. And this study was done on July 22nd, 2016. Okay, so what does this tell me? It tells me that if I go for the surgery, I'll be put under a knife, okay? If you go under a knife, anything can happen. You're prone to a lot more issues, okay? So if you were to go to physiotherapist 2 to 3 times a week, you build up your cardiovascular fitness because you're definitely going to be put to work, okay? Nothing too terrible. You're not going to be bench pressing or anything, okay? So you're going to be taking it easy, slowly incrementing. You build up muscle mass. You'll get a new muscle pattern, okay? You'll be able to be stronger and yield the same results as a surgery. Also, are you not sure if it's your meniscus that's causing you pain? I'll put a link below that's by doctors in physical therapy, and they do tests that may indicate if it's your meniscus or not. What? Don't listen to me. Okay, so 850,000 meniscus surgeries are done in the U.S. every year. 850,000. So I wonder how many of them were told that the non-surgical versus surgical option, yielded no significant injuries. I wish some people knew. I'll also put inside the operation room for a meniscus repair and the video link below, okay? Again, this isn't medical advice. Research and form your own opinion. That's what the whole point of this channel is to not drink, don't drink the Kool-Aid, go investigate, see what's in it, okay? So the meniscus can fold up, lock the knee from getting extension, like kicking out, or it might be a bony prominence that can impede a normal life. Do what feels right. Don't drink the Kool-Aid. If you think what I'm saying is a bunch of hoopla, consult with your doctor, look online, see what your brain tells you. If you feel like you can't carry on, do what you need to do, man. The screw home mechanism, locking that occurs between femoral condyles and tibia during final degrees of extension of the knee. So what does this mean? Okay, so your femur bone is up here, right? This is your femur bone up here. This is your femur bone, okay? Then you have your tibia and fibula. So when you stand up straight, they lock into place, right? This extension, it clicks into place, and you barely have to use any muscles to stay in that position. So when you're during standing, the femur internally rotates with total knee extension. What this means is that when the tibia is firm on the ground, right, and you come up, the femur kind of rotates in a little bit. What does that tell you? That the knee doesn't only just kick out and in, right? Doesn't extend and flex, but it also has a rotational component to it. It's not voluntary, but it happens. And this happens because your medial meniscus is deeper on the medial side, okay? Which is on the inside. It's deeper, so when you come up, that femur bone kind of clicks into place. For the older population, this is very important, okay? Hip flexion throws this knee lock out the window. So if your old man or old woman is sitting down all day, they read newspapers or whatever they do nowadays, knitting, I don't know. Okay, so they'll stand up and you'll notice that they're kind of like this, right? And what does that do to the knee? It puts it into a flex posture, okay? What that means is they're going to have difficulty, standing up for long periods of time because they're going to be depending on their muscles all the time, okay? They're going to be sore. It's not going to be good for them. Also, it makes them more prone to falling forward. So stretch those hip flexors, okay? Stretch them. Yeah, get them moving. Cut the grass. Walk. Something. The patella, okay? The patella is inside of your quadricep muscle. The muscle tendon, which is the white part. I'll put a picture up, okay? Meaning it's relatively free moving. You can try it yourself. So if you grab onto your patella, right, this little bone in your knee, you can shift it right, you can shift to left. And you'll notice when you kick out, it'll move up. When you flex your knee, it'll come down. Okay, this is a normal moving patella. If this patella is restricted in any kind of way, you won't be able to reach terminal knee extension or reach full flexion, of the knee. Positioning of this bone can vary from person to person, and muscle alignments affect this as well. This is the bone that typically cracks when you kneel down. Usually, knee popping isn't an unhealthy sign. I'll post a video down below, but typically when you squat down and pick something up, you'll hear like a little crack. It's not indicative of an unhealthy knee unless it developed from like a recent sport injury or something like that, where somebody just ran and blew into your knee. Then it's popping. Then yeah, you probably should go check a doctor with that. Okay, the patella's main function is to increase the quadriceps function, okay, knee extension and flexion. So I'll play a little GIF here. So you'll see that without the little rock, which is simulating the patella, he has to force movement a lot more. And what that little patella does, it creates a lever arm to where the quadricep muscle just has a lot more power, okay? So what I said earlier was that the patella plays a role in flexion and extension of the knee. And if you feel like you can't reach full extension and full flexion, it probably may be the patella, but again, it may not be. It may be something inside the joint. Do your own research. Ask your doctor. An x-ray may be warranted, okay? So I'm not going to go over the Q angle and what it is. I will post this PowerPoint on my Facebook, so I'll drop my Facebook link down below, and if you want to have this PowerPoint, You can download it, or you can just YouTube what a Q angle is and how it varies from a female to a male, and yeah, how it affects the body. But long story short, what it is that it causes more medial stress on the knee. So on the inside of the knee, if your hips are wider or this angle is bigger than usual, and you're more prone to meniscal issues. Okay. What you can do about it is you can do some glute med strengthening, because that'll pull you a little bit more into external rotation. The knee ligaments. You have cruciates. You have anterior cruciate ligament. You have a posterior ligament, lateral collateral, medial collateral. And these all do very simple things, okay? So when you jump forward, all right, let me see here. As you land, your femur wants to move forward on your tibia, and your ACL will rip if excessive forces happen, okay? It's the most commonly ripped. So I'll demonstrate this. As you jump forward, okay, this femur will want to move forward. If like, let's pretend it's just two bones, okay? This tibia is fixed, and you jump forward, this femur is going to want to pop forward, and that ACL keeps it in place. Or you could also say the tibia wants to move posterior as in relation to the femur. The posterior cruciates prevents excessive posterior motion of the tibia on the femur or anterior motion of the femur on the tibia. This gets most commonly injured during motor vehicle accidents, MVAs, because what will happen is your whole body will shift forward on your seat, and it'll hit the front of the car, and that'll cause that tibia to want to, posteriorly move and rip out, and that's what happens. Don't get in a car accident. Okay. A lateral blow will cause a unholy triad, which means, the ACL, well, you don't know. The ACL, the MCL, and medial meniscus get ripped. That is a unholy triad from a lateral blow, which means it's very common in football. They're coming in, someone tackles you, it blows out all that, okay? Also, excessive rotation with the planted foot can cause injury too. Big duh. PCL is commonly injured. The posterior cruciate ligament is commonly injured during a car crash, like I said. Yeah, that's it. And these are the pictures. You can see the ACL here. PCL are like more towards the middle of the joint. Lateral collateral more on the outside. Medial collateral on the inside of the knee. Links below. So I have a lot more in-depth information. I think this is enough for superficial knowledge. So yeah, keeping it simple, okay? The links below will show you how to test the ACL, the PCL, LCL, MCL, the whole ligaments of the knee. I also will put in there a more in-depth anatomy video, how to test if it's a meniscal issue or maybe it's not, okay? I'll also put the operation video in there. Cool. Thanks for watching me today on Myosin Brigade. Signing out.